Hello, everyone. It's Monday, August the 17th. Very regretfully, over the weekend, we lost 3 more people in West Virginia. Our 158th death was a 67-year-old female from Pleasants County. 159th death was an 88-year-old female from Mercer County. And the 160th death was a 95-year-old female from Logan County. Again, and I've said it a million times, I don't want to sound like a broken record, but these people deserve absolutely the respect, and I'm going to continue to try to give them all the respect that I can give them. I'm going to offer up for all of us to keep them in our thoughts and prayers. They're not a statistic, they're a family, they're a name, they have loved ones all around them, and we thank them so much for being great West Virginians and all the contributions that they've made throughout their lifetime to all their families in this great state. So please keep them in your thoughts and your prayers. Our daily positivity rate today is at 1.18, and that's great. But we did have 178 new cases over the weekend, and our active cases have decreased just a small amount from 1973 down to 1941. Our hospitalizations have decreased just a little bit, from 135 to 134. Our reproductive RT number is at 0.96, which is really good. 13th best at this point in time in the nation. And I can say that, and it surely couldn't have happened this quickly, but right almost at the very day that we started wearing our mask as a mandatory gesture anytime we were out in a public building, that RT value started down. And so today we're 13th in the nation. We got as good as 5th in the nation as far as the good side. At one time, right about the time where we made this mandatory, we were dead last in the nation. So, there are different things that we're doing, within our communities and within our cities and homes to make us safer and better. We still lost 160 great West Virginians. I get that. But at the same time, we're dealing with an invisible killer that is really tough. And so stay the course, West Virginia, and keep on doing the good stuff. There's been some discussion over the weekend. I just found out about it, to tell you the truth. But there's been some saber rattling of the media, which is just as ridiculous can be. And from the standpoint that what we did is we made the metric for our mapping, as to when we could go back to school, and we pushed it in a way that would make it, skew it to where it would make it more, it would appear that it would be easier for us to make it in a way to be able to force us to go back to school, which is so preposterous it's unbelievable. I have said 1,000 times, and if I say it 1,000, I believed it 1,000. Nobody is going to pressure me in any way to put our teachers, our service personnel, our kids especially, back into a situation that I feel in my heart is not as safe as we can possibly make it, and absolutely as prudent a decision as we can make it. Now, in all that, we came up with a way to say, we're going to give our parents a choice. We're going to give our from the standpoint of being 100% virtual, or a hybrid of that, or back in school. Now, and then what we did is we studied, and we went with the experts, and we studied as hard as we possibly could in every way you can imagine, and we came up with something that was revolutionary, to tell you the truth. No one in the nation has come up with this type of color coding and all that kind of stuff like what we have and everything, and we feel like it's really good. We also said along the way what we would do is we would listen, and we would be fluid in what we do. So we're going to tweak it just a little bit right now and everything, and we're tweaking it this way. You know, the people that are in the prisons or the people that are in our nursing homes, those people are in a captive atmosphere. And so to make it really, really, really simple, we count those people on the metric that we use as one. And so if at a nursing home we have 18 breakouts within the residents of the nursing home, they are counted as one. If at a prison we have 42 prisoners, inmates that have this, they're counted as one. Now, one thing we want to tweak is just this, and we really struggled a lot with this, and that is we made the staff, if there were 20 in the staff, we counted that as half of that, as a 10. Well, we're going to change that back to counting the staff one for one. In other words, if there's 20, we count it as 20. And the reason we're doing that is we can't get around the fact that although they are at one nursing home, and they got this at one nursing home, yet they still go out into the community, and we can't put our arms around them at that nursing home. So we're going to have to count them as forever how many that it is, that's how they'll be counted. Now, the other thing we're going to do, just for the sake, I'm going to go just a little bit deeper in the weeds and try to explain to you why we tweak the numbers from the Harvard scale just a little bit. And here's my belief on this whole thing. You see, we're challenging all of our counties to try to do as good as possible. Every county wants to get in the green. Now, and in doing so, the Harvard model said 0 to 1, you're in the green. So in all reality, many of our counties would have looked at that as, well, you know, we can get in the yellow, but we'll never make it to the green. And I want our people to all feel like they have an opportunity to win. And absolutely, from that standpoint, and really that standpoint alone, I wanted us to have the opportunity for our people to get in the green. Now, if you look at what we did before, at 25, you were red, just like the Harvard model, we stayed right with that. But what we're going to do now is we're going to pivot, and we're going to back up just a little bit, and we're going to go right exactly with the Harvard model on every level that we go through except one, and that is the green. And what we're going to do on the Harvard model is they had 0 to 1 on green. We're going to go 0 to 3 on green. And as we go 0 to 3 on green, then we're going to stay at exactly the level of yellow. They were at from 1 to 9 on yellow. We're going to go from 3 to 9 on yellow. The exact same thing on orange and the exact same thing on red as the Harvard model. So we're going to still be able to motivate our people that if they can get in the green, we want them to get in the green, and we want them to stay in the green. So nevertheless, that we're tweaking this. It is a 7-day rolling average and everything, and all we're doing is just trying to clarify and just make it just a little bit better for everybody. And you'll see our maps and everything, and they'll be up, you know, do we have it yet, Jordan? We don't have it, but maybe we'll have it by the end of the briefing today. And so the net of the whole deal is just like I said, from a congregate, you know, setting and everything, you'll be counted as a 1. From beyond the congregate setting, you know, if you're a staff member or whatever like that, you'll be counted forever how many that it is, because you're going out in the public, and we want to recognize that. But we're just trying to make it better. And I've got a map right here of how it will look. I don't know if you can see this or not, but you can probably see some of it. But in this situation here now, differently from the map that came out on like Saturday, you know, we now have 4 counties in the orange. And I think they're Boone, Mingo, Wayne, is that correct? I think it's Boone, Mingo, Wayne, and Taylor counties that are in the orange, and Logan's still in the red. So, and we've got others that are probably pushing, getting close. We've got to really watch and keep working at as best we can. Now, before I go any further, let me report just a second on Logan. Logan's doing better. Now, it's still got a long ways to go. We know that, but we got 243 active cases down there in Logan. We got people that are scrambling in every way to make it better. The numbers are a teeny little bit better right now, and we've directed additional DHHR and National Guard people to send additional support staff down there, and we're talking to everybody and working with everybody down there, and I think it's all going. It's getting better in Logan, at least for the moment. Let me see. Okay, just some announcements. Our churches, we still have three active outbreaks reported in churches. They're in the counties of Cabell, Wood, and Taylor counties. We absolutely need to follow the guidelines, follow all the things that I've told you over and over. Keep a pew in between you. Absolutely wear your mask at church. Do all the right things. And for those elderly and everything, that if you can maybe get church online, or maybe if you can just be super safe and everything. And for all the loved ones of the elderly, please watch them really close and try to help in every way. We now have over 2,300 applications for our small business dollars and everything. We're working, and I hope we'll be out really soon with a way that entrepreneurs that aren't counting themselves as employees can apply. And we'll start with sending them a check for $2,000, and because we don't know exactly how many that number is, we're thinking that number could be as high as 80,000 in the state, and so we'll start with sending them $2,000. From the standpoint of our others that have employees, you're going to get $5,000. There's been $9.5 million that has been awarded so far. Just please continue to send your applications in and work with us so we can get you those dollars. From the standpoint of our cities and our counties, we've now sent out almost $80 million have been awarded to 169 cities and counties, and we continue to ask you to do the same thing. The more we get in, the more applications we get in, and the faster we can get through it, we'll just keep pumping that money your way. We have free testing today. That's going on this week in Lincoln and Hancock counties. Next week we'll be in Boone, Lincoln, and Webster counties. And I may have misspoke. I'm going to go back about this map just a second. I think these counties are Boone, Mingo, and Lincoln counties. I think, and I said Wayne, and I misspoke about that. So it's Boone, Mingo, and Lincoln counties that are in the orange in the south, and Taylor County in the orange in the north. So I hope we'll have a better map up here in just a little while. Our summer feeding program is still going on. The 696 sites that I've told you about over and over and over. Please, we don't want a West Virginian going hungry. If you know of one, or or you are one, please just call us on 211 if you're having trouble getting food, and we'll figure it out. But other thing is, we're running out of time on our census to be counted. We've got to get counted, everybody. That's all there is to it. I just keep hammering the same thing, but it's really true. We have to get ourselves counted. Get yourself counted. And West Virginians, if I can call upon you to help me be community or street leaders or whatever like that, and help me some way be a captain to get us across the finish line and get us counted. Last just couple of things, and I'll be done, is from our mapping. If you'll look at our charts just one second. From the standpoint of the top one, we're getting a little better. We've got 6,500 people that have recovered and 1,900 roughly that are still active cases. And you can see that's starting to move again our way. We really need it to really move our way. From the standpoint of our daily positive number, I think this is probably the first day in a month that we've had a daily positive that's dropped below that dotted line, and we're at 1.18, and that's good. That's where we want it to be. And as far as our cumulative positive, we're at 2.39, and that really hasn't changed, but that's expected. We're not going to get a tick down just from that one day. We have now tested 360,000 people in the state of West Virginia, and that's in excess of 20% of our population. That's really aggressive, and that's really good. The only other thing I'd report is just this, is the vice president was in West Virginia this weekend, and we had an opportunity to sit down with his team, and discuss, ideas in regard to how we attack and what we're doing with this COVID-19 deal and all that stuff. And really, they were very, very, very impressed with what we had done thus far in West Virginia. They were tickled to death with their numbers. Of course, they saw the numbers and they knew the numbers. They were amazed that we had tested in excess of 20% of our population. But more than anything, General Hoyer did a terrific job of presenting, what the Guard had been doing and all that we had been working on within our state to make us self-reliant upon, that we did not have to rely upon anybody throughout the country and or the world to come up with PPE in West Virginia, and how we were manufacturing the new masks that we're getting ready to put into production and everything. And he did a great job with that. And Dr. Clay Marsh presented from the standpoint of the things that we're doing as far as going back to school and our color coding and all the different things that we've done from the standpoint of, being the first in the nation closing the nursing homes, or not closing, but closing visitation there, and first in the nation, to test all the nursing homes, the assisted living and all that kind of stuff in lots and lots of ways. And the Secretary of Agriculture, Secretary Sonny Perdue, was there. He really was all over our color coding and really thought that was innovative, wanted to hear more about it. And I'm sure Dr. Marsh and others are getting information to him right now. But it was a really good day. I can tell you that our president and vice president and all their team, they're all in and trying to help in every way they possibly can in West Virginia and all across our nation. So keep them in your thoughts and prayers, because it's a tough job, really, really tough job. And there's no pat answer, there's no guarantee of any answer and everything. Everybody's just continuing to do a great job. And I thank General Hoyer and Dr. Marsh. They did a great job, and I really appreciate them being there. So we also, before I forget it, and surely not to pass over this, but we had Senator Capito, we had Congresswoman Miller and Congressman Mooney there, and they did a great job as well. They really, all these people are trying to help. They're just trying to help in every way. So let's just keep moving it north. Thank you. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and good afternoon. I think the governor has really communicated very well some of the tweaks that he has directed, which I think are really quite smart and also very innovative. The model the color coding model that that's come out of Harvard from the Global Health Institute really does not start to identify and try to isolate community spread versus the combination of community and congregate spread. And that's actually really, really important, because what we really are concerned about in our counties, particularly related to school openings and some of the guidance that we had talked about last week, is related to the amount and the rate of community spread. We know that the congregate spread among, say, residents of a nursing home or correctional facilities inmates, they are in that place and they're not going to go to the community to spread. But I think that tweak to make each employee just a community member in these congregate settings and to reapply some of the thresholding, the expansion, slight expansion of the green from the Harvard model is, I think, really important because we live in such a small population state, and the Harvard model really hasn't been adapted specifically to a state like West Virginia, but maintaining all the other thresholds, that threshold from yellow to orange and then from orange to red, allows us to be very consistent with what I consider one of the best national models, looking at the rate of new cases over a 7-day rolling average. And that also provides West Virginia with great incentive to be in the green, as the governor said, but also incentive to maintain the community health, because we know that the single most important predictor of problems in schools and problems in businesses is really the health of the community and the rate of spread in the community. So I really give the governor all the credit in making these moves to try to make sure that we are making this as safe as we can for all West Virginians, but also to be able to get our children and our young people back in classes so they don't fall behind. We don't want a whole generation of people that need to catch up for the rest of their life. So I think this is a wonderful new tweak of the existing model so that we are able to accomplish all the things that we're trying to do for this great state. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. Just want to echo what the governor and Clay have said. We've worked very hard to try to get a system here that's a new approach for folks, but it's also a safe approach, we believe. We're going to have more information on the website this afternoon. We'll have that as quickly as possible, have a new map up. We also have a new dashboard rolling out tomorrow that will have quite a few additional items to it to review for folks. Again, our approach has always been to be transparent and to try to provide all of the information we can. When that information changes, we will update that as quickly as possible. So we look forward to rolling that out tomorrow and pushing that out for everyone to see. Do you have any comments?
Sure. Good afternoon. I also want to just reiterate and repeat some of the stuff that we said, that we do listen to the feedback, and over the weekend we did hear a lot of chatter, as you'll call it, but as Governor Justice stated, we do want everything safe and we do listen, and I think this new map that we will put out later on today will help explain it, but we listen and we care about everyone, and we'll do what's safe for the state and for the children of West Virginia, but hopefully this will help explain things better, and we'll continue to do the best that we can for everyone.
All right, thank you both. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. We continue missions in supporting testing, particularly for higher education, as well as sanitization efforts and PPE distribution. Yesterday, completed support to Charleston Fire Department as well as South Central Regional Jail. As the governor mentioned, he's directed us to provide additional support to Logan, particularly administrative support in the health department, as well as we will be providing support to Rosewood Nursing Home, as well as technical support at Lakin and PPE support for those facilities. Thank you.
All right, thank you, General. Our first question today from members of the media is from Annie Moore with WVVA.
Good afternoon. Is the new map going to move any counties into the red tonight, such as Raleigh County, which is 21 positive staff members at the Pine Lodge Nursing Home?
I couldn't hear it real well. Could anybody?
I can repeat it. Do you anticipate the new map moving any counties tonight into the red, such as Raleigh County with 21 staff members at the Pine Lodge Nursing Home testing positive?
No. Is this Angie? Is it This is Annie. Okay, Annie. I'm sorry. Annie. No. The map that we have right now, and this map is the new map that is coming out right now, and so you'll see that Raleigh County stays in the yellow and everything. We want them to bear down because we don't want them to slip into the orange and everything because. Like I said, we now have 4 counties that are orange, and that's Lincoln, Mingo, Boone, and Taylor County. And where we stand right now, we won't be able to go back to school. We will not be able to play our games. We'll only be able to practice. We won't be able to go back to school until we can pull them down in the yellow. So we got to get them now. Now, once we get back to school, if we drift into an orange, we'll still be able to go to school, but we'll only go to be able to practice and everything and not play games. So we got to get the people down out of the orange, and we want to get people into the yellow and the green.
All right, thank you, Annie. And as Secretary Crouch said, this map will be posted on the dashboard shortly after the briefing. Our next question today comes from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. I'm going to follow up on that, Governor, what you were talking about with the sports and everything. What will crowds at games look like there? Will there be spectators permitted? Will they sit every other seat like in church? Could they sit in a checkerboard formation if they were wearing all masks? Maybe it's a Dr. Marsh, maybe it's a Dr. Amjad question, but Governor, I'll start with you.
Well, I'd lead off by saying this. We're still waiting on additional information from the SSAC, but they'll absolutely be reduced in crowds, and they'll absolutely, we'll have to maintain some level of social distancing. Our stadiums are big, and so we still do believe we can have at least family members or, a certain number per child or whatever that we allow. But I don't have those guidelines back from the SSAC. And if someone else from the medical community wants to jump in, but the bottom line is we will have reduced crowds, and we will try to follow guidelines and protect ourselves in every way we can.
All right, thank you, Paul. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers. My question would be this. I know the metric was supposed to be very much medically driven by the health experts, Dr. Marsh, DHHR. And I think I've seen it reported somewhere else that even, the Clayton Birch, state superintendent of schools, was specifically left out. That way, the metric that was developed was strictly a medical created metric. Hearing that you guys are changing these numbers slightly in how you calculate the nursing home staff or corrections staff and tweaks to the overall plan, my question would be, are you doing this? Are you making these changes, based on the medical part of it, or are you making it on political considerations or the feedback? Because I understand you're paying attention to the feedback, but if it's a medical metric, the public feedback shouldn't really matter that much. Thank you.
Well, Stephen, let me answer. First of all, if there's anybody out there that believes that we're doing this, or there's the political component that enters into this spectrum, they've got to be either so biased or living in a cave or whatever it may be, because that's not going to happen. That's just not going to happen under my watch in any way. From the standpoint of tweaking to make it better, absolutely, we want the understand. We've tightened it up a little bit from the standpoint of, where the yellow and the yellow and the orange were. We've just tightened it up a little bit in sync with the Harvard model. And we have absolutely recognized that these staff members, whomever it may be, or a supervisor at a correctional facility, they are going out into the public, and so they really ought to be classified as community spread potential. And so we're just trying to make things better. I mean, this is a massive undertaking, and from the standpoint of the participation from Superintendent Birch and the Department of Ed, they're right with us every step of the way in everything we're doing, because we want to stay step for step with all of our experts. And in this situation with schools, our Department of Ed and our medical teams and everything, they're working side by side in order to bring us this information.
Governor, do you mind if I just make a comment real quick?
Please.
So I think the other important consideration to recognize is there is no standard for this pandemic. And even the Harvard Global Health Institute model was really done by getting the consensus of a group of public health experts and folks that they include in their group. But they also have created a model that they believe will meet the need of having these cut points so that we are creating a map that we can follow. And I think that what we've done over the weekend is continue to think about this, to talk to other people. And this is a medically driven, or really public health driven, set of metrics. But again, nobody has ever done this before. And I think that the real tweak that I actually think is really important, and it's something we'll feed back to the Harvard model, is that the Harvard model does not separate congregate cases. And in fact, in communities, when you're really thinking about schools and spread and control of the virus, community spread is really what we want to see. So I actually think that we will be able to help the Harvard folks with giving them insight into this model. And maybe this is something that we can start to work on together. But the key is that there's no standard. We are all as a group trying to work with each other around the country and within the state to come up with the right model so that we balance that protection of people, most important, with the safest environment to open the schools and businesses and other things.
And Jordan, if you'll come back to me just one second, and let me just say this to everyone. What we are embarking upon right here is a model that is as good as the nation's, but even better. A model that basically does incentivize us on a county by county basis, but a model that is more tailored for West Virginia in that it allows us, and it doesn't differentiate between the yellow or the orange or the red, but it allows us to get to where we feel better. I mean, from the standpoint, I personally, if I'm striving to get in the green and I can get in the 0 to 3 category and get in the green, that's a motivation for me in my county. And so I want to go back and just say just this: we are tweaking only to make things safer and only make things better. Now, I want to say one more thing real quick. Our county superintendents, all the people that have absolutely put in the licks to come up with the plans and do everything they've done remarkable, unbelievable work. At the end of the day, we want all of us as West Virginians. We don't want to separate and have one faction over here and one faction over here and one faction over here saying, well, this isn't really the Harvard model. They made it easier to get, to basically get us back into school. So we want to listen and gain all the knowledge that we can possibly gain. And with all of that, what we want to do is we want to all together stay together as West Virginians. And at the end of the day, you may not think that has been as important as it has, but that has driven this state to become the miracle and the envy of the nation. Because the state, not Jim Justice, the state has stayed together and moved in a positive way. Now, we want our school setting for our children and our teachers and our service personnel to be just this. Now, just think about just this. To the very best of our abilities, we want that setting to be. I was on the phone with a doctor that was the head of a giant department at Johns Hopkins. And I said to him, I said, Doc, are you not worried, when you go to work because of all the cases, the COVID cases that are right there in your hospital? And he said to me, he said, Governor, he said, do you see that I think in my work that we have made our place 5 or 6 times safer maybe than I could be if I were out in the community? Well, you see, that's really the same premise that we want to do with our schools. We want to try every way we possibly can to make that setting, that building, that place to where it is more safe than you would be if you were at the Pizza Hut or wherever it may be. So that's our goal. That's our goal, to stay together. So we listen and we tweak and we make it better. But I think we've got a really, really, really good mapping and really good plan.
All right, thank you, Steve. Next, we'll go to Larissa Casillas with Nexstar Media.
Hi, I guess I'm confused about the green category. So 0 to 3, is that single cases?
Dr. Marsh, you explain that. It's
Yeah.
per 100,000, but Dr. Marsh will do it.
Yeah, so what we have done is we've adopted the same approach that Harvard has done from an incidence rate. Remember when we talked about there's really there's the first phase is what we have sort of called the gating strategy, and that is having a 7-day rolling average of the percent of our tests that are taken being positive, and I think ours right now is 2.4%, so we want that less than 5, and so that certainly we're well below that. Then the incidence rate is the daily new case rate, the daily new cases, that is basically then changed, adapted to 100,000 population, and then we create a 7-day rolling average. So it actually averages the last 7 days of daily new cases in the state and in each county, and that then gets corrected so that the population differences of counties like Kanawha County versus Pendleton County versus others then basically are all in the same frame. So this is really a reflection of the daily new case rate that we've seen over 7 days average on today's date. It changes every day. That is corrected for 100,000 population.
And Jordan, come back to me just 1 second. Let me just say this. Let me try to make this to where even I can understand it. But as I understand this is look at it just this way. There's the statewide number that we got to look at first and check the box. Well, if we're under 5, we check that box. And then we go county by county, and we've had to weigh the counties because some counties don't have very many people, and some counties got a lot of people. So we had to come up with a metric to where all the counties are weighed the same, and then we look at a 7-day average. Every day it updates because it's 7 days. It's the last 7 days, We look at 7 days, 7 days, 7 days, and we do it on a percentage basis of 100,000 people. So we do it to where all the counties, it will work for all the counties in some form of almost like a weighted average, but it's not necessarily that, but it'll work as a metric for all counties. And so that's how, the long and the short of it is you check the box on the first level, under 5%. Then you go a 7-day average. Then you weight it to 100,000 population and come up with a percentage. And then that's your number for that county. And then we color code it, green, yellow, orange, or red.
All right, thank you, Larissa. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, it's Kenny Bass with Channel 8 and Fox 11. I had a question, a follow-up really to something I asked on Friday, and I got an answer from Dr. Marsh. And I wanted to make sure I understood it. So maybe the governor or Dr. Marsh can weigh in to clarify it for me, because I'm still a little cloudy. When I asked about the medical advice that was given in relation to playing football, it sounded like that the counties were taken care of, as long as the counties were in some type of order and they followed, I guess, the number system that's now on the map, that it would be up to parents to decide if their children would be involved in sports, including football. I know there's a national debate raging about football, but playing football is not really like going to class. There are just some inherent things in it that are very different as far as close contact and being in somebody's face, etc. So, what exactly are we using as a state from a medical standpoint to guide us on playing these extracurricular activities, including football, and that we're directing the SSAC about what to do and not the other way around? Thank you.
Okay, Dr. Marsh, let me lead off. First of all, the tail's not wagging the dog. The SSAC is not telling us, we're telling the SSAC. And from the standpoint of the medical input, I'll let Dr. Marsh weigh in a whole bunch on that. From the standpoint of the parents deciding, the parents, if I heard you correctly, I mean, Kenny, the parents, have their choice in this through and through, So the parents, if they decide that they don't want their child to play football and they want them to go to school, that's fine. If they don't want them to go to school and they want to do it virtual, that's fine too. Now, but from the standpoint of what we think is safe for our communities and our children, the metric that we've come up with is what we think is the safe approach to doing this. But anyway, I'll pass now to the medical community on that.
Well, Kenny, thank you for your question again, and maybe I'll try to answer things a little bit differently. We know that COVID-19 has some substantial effects on the human body. We know that COVID-19 seems to create or cause hospitalizations and death as people get older and have pre-existing other problems like obesity, diabetes, high blood pressure, heart disease, lung disease, clotting problems. But we also know that COVID-19 can impact others, including children. And we talked about 97,000 children were infected with COVID-19 in the last 2 weeks of July. A concerning side effect of COVID-19 in people that averaged about 50 years old that was reported in Germany was heart side effects. And there was evidence that COVID-19 can directly infect the heart tissue and can cause irritation and inflammation of the heart called myocarditis. The Pac-12 and the Big Ten, which are two major Power 5 conferences in the U.S. And colleges, both canceled their football seasons because they were worried, at least this part of the year, they were worried about those manifestations. And I think that as other conferences did not. So as we would make advice to parents, and that's what I tried to articulate on Friday, we would, we need to disclose, the risks and the benefits of playing. And the risk would include having infection that could lead to a heart issue, or there's brain issues. We know that loss of taste and smell is one of the major sort of signs that you might have COVID-19, but other things like fuzzy memories, people having low energy after this, blood clotting, all those things can occur as side effects from COVID-19. So what I tried to articulate on Friday was that, each person has the right to make a decision about what they want to do in their life. But the key for us is to make sure that they understand the risks and the benefits. And because many of our students who play sports are under 18 and are minors, then it would be important for their parents and those individuals to work closely with their schools and coaches to understand what, may be the risk to them if they play. And if they decide that those risks are too much, then they shouldn't play at this time until we get a vaccine or get drugs. Other people might feel differently. And I was really trying to say that while we do everything to make sure things are as safe as possible, these are decisions that really, to me, need to be made by informed parents and students to decide what they want to do, and also from the schools and the SSAC to provide that right guidance.
All right, thank you. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I had a few questions about the Kids Connect program. So who is actually doing that installation work? What does $6 million buy us? Is this intended to be a permanent program that we would have to fund in order to maintain? And are we actually on track to get everything done by September 8th? Thank you.
Okay, Charles, I don't know exactly who's doing the work. You know, the Department of Ed is administering all that, and I don't know exactly who's doing the work, but I do know this, that the work's going on, and it's going on very, very rapidly, and from what I've been told, we're on target to meet that September the 8th, date, and from the standpoint of the benefits to our kids across our state, it's very numerous. And to the benefit of our higher ed facilities, it's really good. So a lot of different stuff that this $6 million is going towards. And in fact, I really believe that we're going to come in significantly under budget. At least that's what I've been told. Now don't run with that because I don't know that specifically, but I've been told that it looks like we're going to be under budget and we're going to meet the deadline and we're going to be ready to go on the 8th.
All right, thank you, Charles. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, all. It's Taylor with the Herald-Dispatch. Over the weekend, it was announced in Ohio that face shields won't be recommended for students, that they'll actually have to wear an actual face mask or covering. So I was wondering if that was anything that was being considered in West Virginia to recommend a face mask over a shield for students.
Taylor, without question, our experts are going to have to weigh in and are going to have to be telling us and guiding us on what to do. But maybe Dr. Amjad or Dr. Marsh or Secretary Crouch, somebody's going to have to answer that other than I.
Hein, do you want to, or Bill, do you want to start and I'll add anything?
Sure. Yes, we've been in communication with Clayton Birch on a variety of these issues in terms of what needs or what should be in effect with regard to safer classrooms for folks. I don't have an immediate answer to that. I think it's a great question. Certainly face shields serve a great purpose with regard to prevention of this spread of this disease, so that those are important. We will get back with an answer unless Clay or Dr. Amjad has an answer to that. I've not been involved in those discussions directly.
Yeah, sure, Taylor. Face masks or masks are recommended for children really greater than age 2 years old. We are saying children greater than 9. There are a lot of children, especially children who have problems keeping things on their face, that you can use face shields. Face masks are preferred though, however, but if a child cannot tolerate it, they can try face shields in the classroom. But those are the options right now in elementary schools. But I don't know if Clay has anything to add to that.
I think the only thing that I might add is, as I understand it from the CDC, face masks are preferable over face shields just because of the tighter fit versus the face shields. But certainly face shields are better than wearing nothing.
All right, thank you, Taylor. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Well, as a common condition, I'm still a little confused over our new metric. According to the Harvard Global Health Institute dashboard today, West Virginia has 8 orange counties, and our metric only shows 4. If we've synced up the numbers, what's the explanation for the difference?
Clay or someone answer that other than I.
I'm happy to take that, Governor, if I can. So, Phil, thank you for your question. I think this is where we have really become innovative. So what we have done is the Harvard model counts people that are spreading in the community and spreading in these congregate settings, nursing homes, prisons, as equal. we have basically decided that we're really trying to focus and to just look and understand what is the community spread. And so that is actually, to me, a real innovation from the Harvard model, particularly when it comes to opening schools and looking at other community-based activities. And so the reason why we have fewer orange counties than the Harvard model does is because we have subtracted out people that have tested positive who are residents of nursing homes or who are inmates in prisons. And that then gives us the community spread component of what the Harvard model shows as the community plus the congregate spread. So that's really the difference and the reason why you see a fewer number of orange counties in West Virginia as opposed to the Harvard model. And our numbers are updated a little bit more rapidly than the Harvard model is too.
This is Bill Crouch. If I could add, Governor and Clay, this is an approach that we began looking at least 2 weeks ago, maybe a little longer, prior to the development of an educational alert map here. So this is something that, from a public health standpoint, we began looking at not just for education, but for how we look at community spread and how we make that differentiation between congregate spread and community spread. So all of the efforts here have been focused on what that spread should be and how we should look at that spread. So it's really an effort that's been going on for several weeks now.
All right, thank you, Phil. Next, we'll go to David Beard with the Dominion Post.
Hi. My question could probably apply to any college town, but I'll focus on WVU because of the size of it. How would an outbreak at WVU affect Mon County's metric in this situation? And there's a whole lot of sub questions with that. Are there any portions of WVU that would be considered congregate rather than community? And would an outbreak at downtown Morgantown or over at Evansdale close Clay Battelle High School that's the other end of the county, 30 to 40 minutes away? It's more than that, but I'll let you just work from there. Thanks.
Dr. Marsh, maybe this is a question again for you.
Sure. So, David, as I understand it, now we'll look to Secretary Crouch and Commissioner Amjad to make sure that this is correct, or General Hoyer. But as I understand it, that each student who is tested at WVU, even if their county of residence is another one, would be counted as part of, and that are in Mon County, of course, would be counted as a Mon County positive, but also be reflected back to their county of residence. So as we start to look at the universities opening, whether it's Mon or Morgantown for WVU, or Cabell or Huntington for Marshall, or other counties and communities for the other colleges, you would count them in the county or in the school's county of origin, but you'd also reflect them back to their home counties where they come from, and you would keep a total for the county that the schools are in, so that you would count them toward that. But Bill or maybe you could make some further or even corrective comments.
No, I think that's accurate, but let me add to that a little bit. Our first goal with regard to public health and what we're trying to do here is to prevent community spread. So the idea of making sure through contact tracing that any individuals that were close to the individual who tested positive are investigated as a part of the process local health departments go through, and that any individuals that need to be self-quarantined, that's the priority. So we do list those, and I spoke to Dr. Smith in Morgantown earlier today to confirm, because we had this question a couple of times in the past few days. Those individuals are listed in Mon County's reports. So we do show those as an active case in Mon County. There's also communication back to the county of residence should the student have just moved in to Mon County back to school, for example, whether that's in state or out of state, to make sure that contact tracing can happen in both locations, so that if the student just moved back into Morgantown, they can go back to whatever home county he was in and make sure that the spread there is contained as well.
All right, thank you, David. Governor, I'll turn it back to you.
Okay, I just want to clarify one thing and make sure that I'm right about this as well. But David, I believe the way this should be looked at as far as congregant, you know, if you look at that, if you look at it this way, you know, our inmates are in a place that they're not going to go out of. Our nursing home residents are in a place they're not going to leave and go out of. And so those would fall into the scenario of what I would think would be counted as a group to be counted as one. But a university student, you know, that goes places or whatever, you know, that student really and truly has to be counted as each one of them as a positive number. You know, we can't, I don't think we can broaden the congregate, you know, definition to a university or a school or whatever it may be. I think, and if I'm wrong, medical team, you know, you jump in. Let's go back to them just 1 second and make sure that I'm right about that before we go any further.
Spot on. Yeah, absolutely true.
Oh, okay, we good? You know, Secretary Crouch and I am, we're good?
Yes, you're right.
Okay.
Yes, Governor.
Okay. So David, you know, maybe that clarifies that a little bit. And the only other thing I would say is just this. Right now, and you know, I really appreciate Phil's question because it's a great question from the standpoint that there is a little bit of a tweak from the Harvard model, but the tweak is a tweak that we think in the state of West Virginia will be, you know, maybe a novel idea that will be adapted, you know, nationwide. It's not, I mean, let's just be ridiculous to make my point. Let's say you had the prison at Huttonsville and you had 125 inmates and you counted 125 and you didn't have a situation anywhere else in the state and everything, and there was no staff infected, but 125 inmates are infected, and that number counts on the Randolph County, and therefore you don't have a community spread at all. You have just a situation there. It's at that Huttonsville correctional facility or at a nursing home, and that's what we're trying to tweak and make even better than the Harvard model that's out there right now. But the net of the whole thing is right now we've got Boone, Lincoln, Mingo, and Taylor County in the orange. We can't go back to school. We can't play, you know, competition, you know, at where we are right now in those counties. And come on, we need you to really bear down and get yourselves in the yellow or better than that in the green. Logan County's getting better. We've got a long ways to go in Logan County. Had a super serious problem down there, and we've lost a lot of great West Virginians. And so absolutely, Logan, we want you to keep on getting better, and we're going to help you in every way we possibly can to see that we get you back and get you back in the green, and we move right along there. The only last thing I'd say is just this too. You know, whether it be the SSAC, you know, our medical experts, the Department of Ed, it be all the people that are out there across West Virginia that are implying or supplying us with input and everything. Listen, let me just tell you, you know, especially these organizations that I just mentioned, from the SSAC to the medical team to absolutely all of the Board of Education people, you have done phenomenal work. That's all there is to it. And I thank my team as well, but just keep up the good work. And all those that are out there that come up with ideas and everything that you can get to us or you can supply, we'll listen, because that's how we get better. You know, nobody has a pat answer or an absolute solid, rock solid answer to absolutely what we're going to do with this. This is absolutely novel. It is a pandemic. Nobody in our lifetimes has ever been through this. West Virginians, you just keep pitching the miracle and the envy of our entire nation, and we're going to try to back you up as best we possibly can in every way. God bless each and every one of you, and thank you.